Okay, so in this video, I am talking about back pain and the best way to create a direct response style ad to generate new leads and get more patients through the door. So this week is going to be on the topic of back pain. Back pain is one of the biggest problems and one of the biggest source of new patients for your clinic. I think roughly about 40% of new patients are back pain patients from some of our clients when we did their statistics and we asked where most of their patients were coming from. So back pain is probably most likely going to be the biggest source of new patients. And in this ad, you can see there's a person with kyphosis that we are using to try and attract people to click on the ad. And when you do this, you want to make sure that your ad stands out. And that's why we're using this picture of someone with kyphosis. It doesn't necessarily mean that we're targeting people with kyphosis, but we are essentially just using it to grab someone's attention. We really want the people who are older that have back pain, they have insurance, maybe they have Medicare, and they just can't seem to get rid of their problem, right? About 92% of potential direct access patients don't seek the care that they need to get to treat the problem, right? Only 8% of neuromuscular conditions are actually treated. So, you know, there's 10 times the number of patient opportunities in direct response marketing. So that's why we love Facebook, we love Instagram, we love YouTube, and we're starting to really like TikTok as well. So Facebook ads is different from Google because Google, you're paying for every click. The people that you're targeting on Google, they're actually searching for a specific problem. Most of the people using Facebook and Instagram and these social media platforms, they're not really searching for any particular problem. They're just browsing through their phones and they're clicking on whatever captures their attention, right? So you have to keep that in mind when you write the ad on social media. So that's why I use the picture of this guy with kyphosis to stand out, because Facebook is a competitive platform. Let's be honest, right? If you're using the same ads and the same images that everyone else is using, guess what? Your marketing budget isn't going to be efficient, and you're not going to get clicks, and people are just going to scroll right past your ad. However, if you grab their attention for that split second, now you can introduce your headline right here. So if the person that is watching the ad or on Facebook scrolling through, now that you for a split second you have their attention and they see the headline and they have back pain, now they're going to pay attention and maybe read your ad. Again, out of every 100 people that actually see the ad, only about 5% of them will actually click. And that's considered extremely high in the marketing world. If you have a click through rate of 5%, you can definitely be sure that your marketing campaign is producing extraordinary results, right? So that's the metric and that's the KPI that we use, that we try to aim for. Okay, so that's why we're using this image and that's why we have this headline. We want to grab their attention and we want to spark that intrigue in the back of their mind when someone with back pain is scrolling on Facebook. And we want to give them a reason to click. So let's see. And for this angle itself, I'm talking about how the right diagnosis for back pain and physical therapy can be one of the reasons why they're not getting better, right? So that again, it provokes even more curiosity. It makes them want to read more because now I'm posing this question in their head. Maybe I didn't get a right diagnosis, and that's why I'm not getting better, right? One of the biggest objections for patients not getting physical therapy is I've tried everything and nothing has worked. Well, the headline that I'm posing, maybe you didn't get the right diagnosis, it hits that objection specifically and head on, right? That question that's going on in their heads whenever they see ads for back pain solutions. The question that's going in through their head is, oh, I've done everything and it doesn't work. So when we write the ad itself, we have to target that objection. I've seen other doctors before and I've tried everything and it doesn't work. And that's why I'm using this headline. The right diagnosis can be one of the biggest reasons why patients aren't getting better, right? So that headline has got their attention. It's posing a very curious question in their head and it's making them think now. Now, they're going to want to read more because I posed that question in their head. And if they really want to solve this problem, now my description is going to help sell whatever it is that I want them to take action on. Right? In this case, I want them to take action on a free screening and a consultation. Right? It's a good offer. It's a great offer. It's a good way to build rapport with patients in your community, and it's a good way to get people to come in. And there's no risk on their side, and there's a lot of value. Right? And if your calendars are empty, this is a good offer because it gives you a chance to convert them into a patient. Now, if you're good at converting new screenings and consultations and Q&As into patients, you can have as high as an 80% conversion rate. One of our clients in Florida, the first 5 direct access opportunities that we sent her, she converted 100% of these opportunities. Now, long term, she's probably not going to hit that high of a number, but I'm going to bet that she's going to hit anywhere from 30 to 50% conversion rates, because she's more of a startup clinic and she's hungrier to call these leads, to follow up, to get back to them as soon as possible. So in the description itself, again, I'm talking about why patients haven't been getting better. I'm trying to sell them and trying to get them to go deeper into this sales funnel that I've built. Right, I want them to go deeper into this the sales process. And I'm just going to pose even more questions. I'm going to talk about all the advantages of this specific clinic. I'm going to answer even more objections in their head that they've had from other physical therapists that they haven't been getting better before. And just sell all the benefits and all the different features and what makes us different. And I'm going to speak to that and just talk about things that they've never really seen before in a physical therapy setting. And that's what's going to get them to actually click and take action. Because a lot of these patients, maybe they've tried to other things, but they just haven't gotten better, and they've pretty much given up, right? I'm going to assume that's why most people they don't take action anymore. So this is one of the ads that we're going to run for our clients, and next week I'm actually going to show you the results of these ads and what we were able to accomplish with this angle and go from there. Thank you for tuning in, and again, look forward to next week's results where I actually go over some of the stats and how well this ad performed for our clients. Talk to you soon.